Well, I don't remember the year that Lifelight started. I think it was after he got EMS started up because he was involved in a lot of the emergency type care issues. And yeah, he started Lifelight as an extension of the hospital because he realized in his dealings as he was in the Army and everything else that the sooner we got the care to the people, the sooner we started definitive care to treat what was actually wrong with the people, the better outcome it was for them. Back then, a lot of the services were ambulance services, which just meant they picked the people up and got them to the hospital as quickly as possible. But in between those 15, 20 minutes, and that's short actually, that's because we're in Houston, we can get to the trauma center in 20 minutes. But some places, they have an hour before they can get, and that's where they were finding out about what they term as the golden hour. They were finding if we could get people to definitive care within that hour to correct what was wrong with them, then they had a lot higher resuscitation rate, a lot higher survivability of whatever was wrong with them. A lot of the things back then were geared towards trauma. Trauma was a lot of what people were more interested in instead of the medical side, just because on the medical side, those are problems that the people, you're going to have like a stroke and there may not be very much you can do once a person has a stroke and all that. So they wanted to concentrate on things that they could fix rapidly, and a lot of that meant stopping the bleeding, getting the blood pressure back up and all that kind of stuff. So that was the reason for the helicopters, was to get them to the trauma centers. Nowadays we have much more than trauma centers. We have trauma centers, we have stroke centers, we have cardiac cath centers. So the medical side is now a big focus of what we do now, because there are things we can do in the field to treat on the medical side that we weren't able to do before. So Dr. Duke, though, was instrumental in getting us to look at getting those services out in the field before, yeah.
Does Lifelight specifically just go to Memorial or wherever? Like you said, there's trauma center, cardiac center.
They just transport their patients to a Memorial Hospital. Okay. They do have, now that they have multiple Memorial Hospitals, they do have helicopters at different than just the downtown. But the downtown one, the medical center one, is their trauma center.
Right.
But yeah, they usually, when they pick somebody up, they usually go into Herman.
Okay.
Yeah. There's another helicopter service in our area that recently has come in. It's called Petroleum Helicopters Incorporated, PHI. They're yellow and black if you ever look at helicopters flying overhead. But they're an extension of the group that does offshore oil wells. So they were doing helicopter transfers to the oil anyways. So they've taken over some of the area that Lifelight wasn't covering, which was down towards the coast, towards Louisiana. So that area is farther east than like towards Beaumont and stuff.
Oh, okay, so farther out more.
Yeah.
But you guys aren't partnered with them. You're just partnered with Lifelight.
Yeah.
What did you think of Lifelight when it first started, when it was first initiated, and how do you feel like it is important to you?
It was awesome when it first started. Not that it's not now, but when it first started, it was groundbreaking, because Lifelight actually flew physicians on the helicopters to the scene. So when we called Lifelight, when that helicopter landed, not only did we get a nurse, but we got a doctor on scene, which was incredible for all the different things that, we couldn't do. We couldn't do things, amputations and all kinds of things that they've put in chest tubes so that people could breathe. And so that was always, you call Lifelight, you've got something bad, and the physician was going to be there. And initially, Dr. Duke was on every one of those flights. For the first, I think, couple of years, he was the doctor that would fly out, and you think, wow, well, could happen, all night, and then the next day, and then yeah. to the point where Dr. Duke had a room up at Herman
Yeah,
that he,
I remember
yeah,
that.
yeah, that he lived in most of the time. So, yeah, so that was great. Now they fly with 2 nurses or a nurse and a paramedic, which is fine. Most of the things that now occur out there and a lot of their transfers don't require a physician. And if they do, most of those people have been trained to a level where they can do things that most regular nurses and paramedics don't do anyway. So they've brought them up to a very, very high standard on those helicopters.
Okay. For the paramedics and the nurses that go, well, the paramedics that go onto Life Flight, are they specifically with Memorial Hermann, or they go through you?
No, they're all Herman.
All Hermann. Okay.
Yeah, they're all Herman employees.